As the summer approaches, many parents are wondering whether their children's summer camps will be able to open amid the coronavirus pandemic. The Centers for Disease Control and Prevention have released guidance for camp directors outlining the steps needed to be taken if they plan to open by the summer. The list includes testing, sanitary measures, increased social distancing, and employee training. However, the CDC does recommend that camps follow directions from state and local health officials. Jay Jacobs joins me now. He owns 3 sleepaway camps in upstate New York and Pennsylvania. He is also the New York State Democratic Chairman and Nassau County Democratic Chairman. Jay, thanks very much for being with us.
Thank you very much. Thanks for having me.
So do you think, Jay, that overnight camps and day camps will actually be able to open this summer?
Well, I sure hope so. I think that's up to government to decide, and I know that they're working on that. I was very happy to see the CDC guidelines. I think they're very workable. Certainly, they go along with a lot of the protocols that most of the camps I've been talking to have already been working on. The camps have been very diligent to make sure that they can keep our campers and our staff safe. And while I know that there are a number of camps that have not felt comfortable looking toward opening, and in fact have decided that they're not going to try this year, most of the camps that I speak with and have been talking to are excited about camp this summer and are working hard to make sure it happens and happens safely.
Well, let's talk about this preliminary guidance from the CDC. Do you think this guidance is going to be hard to follow, given the social and open nature of summer camps?
Well, I think in the first portion of the guidelines, when you hit the first threshold, I think they talk about being able to assess and determine whether children are healthy and staff are healthy before they get to camp. Most of the camps I've been speaking with are going to engage in a very rigorous pre-test before campers and staff ever get to camp, and for any visitors who come into camp. And then camps like mine, as an example, are going to do a secondary test, a different type of test, an overlay, if you will, to make sure absolutely that we don't have COVID-19 in the camp. And that's going to be done as soon as people arrive in camp. So it's a double testing process. I think that kind of screening is going to make for a much safer summer for everybody. And then, of course, the camps are going to be closed down. So nobody comes in, nobody goes out without testing. Everybody is in what we call this protected environment. And I think, again, that's another measure that it really even exceeds what the CDC is looking for us to do.
So that's access to the camps themselves. What can families and campers expect day to day, you think?
Well, I think day to day, look, parents have to recognize this. You know, the question isn't really between whether you should send your child to camp and take a risk of their safety or leave them home and have no risk. Unless you're prepared to lock children away in the house all summer long without seeing any friends, there's always going to be a risk. They're going to be out in the neighborhood playing basketball in somebody's driveway, at neighborhood pools, friends' pools. Maybe if a mall is open, they'll be at malls and hanging out. Social distancing with children is really a very tough nut, very difficult. So by our approach, testing, making sure that we know that the population that we have by multiple tests is not does not carry COVID-19. I think you've got a lot safer option, and I think it's less risky, frankly.
Well, most of the children that attend your camps live in the tri-state area, and we know that more than 100 kids in New York State have tested positive for a mysterious illness that's believed to be linked to COVID-19. Are you concerned that this new sickness will further impact camps and enrollment in them?
Of course I am. And it's not so much I'm concerned about the enrollment, because I think that'll be a matter of parents understanding the nature of this disease. But I mean, we have to watch out for children. The good thing about this particular Kawasaki type syndrome, and I've done an awful lot of reading and spoken to medical folks on this, is that it's very detectable, you know, with a rash and fever for several days. And we have medical staff right in camp. We've got doctors, in our case, multiple doctors and nurses on the grounds. They would pick up those symptoms in a flash. And if you get children medical care promptly, it's very curable. This is not something that you catch from another child. If someone in your cabin has this Kawasaki-like syndrome, you're not going to get it. Only 1 in 10,000 children carry the gene that promotes this, and it has to be triggered by something else. And even now, I read Mayor de Blasio's recent tweet. It turns out that only just over half of the children tested had any relationship to COVID. This is something that's been around, and we get 3,500 to 4,500 cases in the United States every year. So we have to be aware of it. It's dangerous. We have to be on the lookout for it. I've never run into trouble and gotten bit on the behind by anything I've been ready for. It's the things I don't know to look out for that I worry about.
So Jay, looking ahead here, I mean, what is your plan if you can't open your camps this summer?
Well, obviously, if we can't open camp this summer, then we're going to have to begin preparing for the next. I think it would be unfortunate. Government has to do what it has to do. They've got to take a look and make the best judgments, and I have a lot of confidence in them, whichever way it falls. They've done a great job up till now, and I don't think they're going to stop here. So if they feel it's safe, I'm hoping that they can see camp opening. The way I look at it, of the total population of people who get COVID-19, only 2% are in the age brackets that come to our camps as campers. A little bit higher when you get into counselors, but not much. And they do very well with this disease, although we've got to be on the lookout. And there have been, tragically, some bad outcomes, which we have to watch for. So, we're going to be cautious. We're going to test. Dr. Fauci said the other day in Congress that if you want to open the schools, it's all about testing. Well, camps are prepared to test. We're prepared to help the schools in September, see what works, see what doesn't work. And while I don't want to think of us as guinea pigs, I do want to think of us as being on the cutting edge of trying to work hard to keep children and our staff safe and lead the way and show how it's done.
All right, Jay Jacobs. Jay, thanks very much for sharing your perspective with us.
Thanks for having me.
Welcome back to Fox 8 News in the Morning. With more and more people going back to work, many families were relieved to hear that daycares will reopen at the end of the month, but there will be some noticeable changes to policy and procedure when they do open their doors. Anna Thomas, VP of Youth Development at the Greater Cleveland YMCA, and she has more on the new guidelines. Anna, thanks for being with us. I want to first touch on how you guys have been open for the kids, for frontline workers, which has been awesome. So talk about that. I know you're proud of your staff for what they've done over the past couple months. So how's it been going?
Yeah, thank you. We've been so proud of the work we've been doing. We opened between 7 and 9 pandemic childcare centers. So we were able to open centers for those essential workers, grocery store workers, frontline workers, first responders, to make sure that when they were keeping our communities safe and healthy, their kid had somewhere safe and engaging to be during the day.
So daycares and summer day camps can open starting May 31st. Anna, talk a little bit about how this is going to work.
Yes, we're so excited. We've started thinking through our opening procedures, and it is going to be a bit different. So we're going to try and welcome young people and their families on the curb or at the front door so that parents aren't coming all the way into the building, making sure that we're taking everyone's temperatures and doing some wellness checks. There's going to be increased sanitation and cleaning procedures, making sure there's lots of hand washing, even more than there was before. So really trying to make sure that we're decreasing the spread of it.
It's hard to imagine how social distancing will work. And you know what I'm talking about, especially for certain age kids. And it's going to be hard for these staff workers, especially for the little kids who are used to getting on the floor and playing with them, or if they're crying, holding them. And so how are they going to be able to balance this? How is social distancing going to work?
I think the word you just said, balance, is the key. So we've been really learning over the past 8 weeks as we've been running pandemic childcare how to do social distancing. It's a lot of visual cues, so tape on the floor, cones, hula hoops, reminding young people where they should be. Everyone stands 6 feet apart in a line, each standing at a piece of tape on the floor. There's squares of 6 feet squares in classrooms, and young people have their square, so that's the place where they play in that area. And then we're learning how you give directions to a group of kids with a mask on, how you console a young person in a way that still keeps social distancing. And some of that is a work in progress.
It is. It's going to be a learning curve for everybody, especially these kids. So talk about maybe what parents should know as they prepare their kids to go in. to summer day camps and talk about some of the guidelines, especially with drop off and pickup.
Yes. So I think preparing, and now everyone sees folks walking around with masks. At the beginning, we were concerned that that might be something we needed to explain, but now that's just part of everyday life. Our staff will be wearing masks as much as possible. We will be taking temperatures as young people walk in, and then we'll be asking lots of questions. Is there any cough? Has there been any shortness of breath? Making sure that the young people that we have in our groups are healthy.
When you think summer camp, you think sports and everybody's having fun and just all kinds of fun stuff that does not allow social distancing. So last question, how's the programming going to work for summer camps? Have you guys thought about that? I'm sure you have.
Yes, and we're going to have lots of fun. There will not be field trips. There will not be sports that all share the same ball. But we were already thinking the other day, all of the things you can do in a gym that don't include sharing a ball, all of the field games, all of the outdoor activities that we can do to have lots of fun, really great weekly themes and fun Fridays, and keeping that social distance at the same time.
Yeah, I remember field day in school, you could do run the bases. So that could be something, fun. Anna, you guys got it all worked out. You've been doing a great job for your community. We appreciate that. And I know a lot of people do.
Thank you so much.
All right, Anna Thomas from the Greater Cleveland YMCA. Have a safe summer. Have fun reopening as well, and all the kids who are heading back. Thanks, Anna.